Welcome to The Whole Pineapple. I'm Ruby Boris.
And I'm Ann Judge. The Whole Pineapple is a podcast about wellness focused around fertility. We'll talk with experts on a wide range of topics, including nutrition, stress relief, sleep, mental health, etc.
And we'll dig into the issues that can cause fertility challenges, like PCOS, or early menopause, or cancer treatment.
So if you're curious about your fertility, whether you're ready to start a family,
or you're preserving your options for the future, let's dig in. Neurodiversity. It's a word used to explain the unique ways people's brains work. While everyone's brain develops similarly, no two brains function just alike. Being neurodivergent means having a brain that works different from the average or neurotypical person. This may be differences in social preferences, ways of learning, ways of communicating, or of perceiving the environment. I'm Ruby Boris.
I'm Ann Judge.
And that was a quote from the Cleveland Clinic. So it's going to be a fascinating conversation, a great conversation about neurodiversity in general and looking at it from a different lens. There's a lot to talk about when it comes to neurodiversity and neurodivergence, lots of nuances, and we certainly won't be able to address all the things today. As I've mentioned before on the podcast, this is something that has touched my life in multiple different ways. It's going to be a fascinating conversation. So I'm very excited. And Anne, you know how long I've been searching for somebody to talk with us about this.
This is your like season 1 goal.
Yeah.
Let's find somebody. And we did. It just took a little bit longer. So
it was surprising when I would go and research, like, okay, there has to be like a specialist or something that talks about this all the time. It was actually very challenging because most of the research that's out there, like if you were to Google neurodiversity and IVF or infertility, you're going to get page after page of studies on does ART, assisted reproductive technology, lead to autism in offspring and the likes.
And we will be talking a bit about what does the evidence say later on in the episode when you are trying to study ART and how it might relate to autism and other neurodivergences, because we know there are a lot of listeners that are going to be interested in that information.
So it was a little bit disappointing to me that there wasn't a different conversation around neurodiversity. Like, hey, actually, for all those neurodiverse people that are seeking fertility care, how do we care for them better? So I'm really excited to introduce our guest today. Dr. Kristen Chambliss is a licensed psychologist specializing in treating individuals coping with infertility, in vitro fertilization, relationship concerns, and anxiety. She currently practices in Friendswood, Texas, so we're already friends, obviously. Not only is she an infertility specialist, but she's also actively working with our professional organization, the American Society for Reproductive Medicine, on a proposal to make clinics more neurodiverse friendly. Welcome, Kristen.
Thank you so much. It's such a wonderful opportunity to get to be here, and I'm so honored to get to speak to both of you today.
Awesome. Well, I kind of gave an intro into what neurodiversity is. Let's define that a little bit more. And also there's a different term that we'll throw around called neurodivergence. So let's talk about those two definitions a little bit more.
The first person to coin the term neurodiversity was Judy Singer in 1997.
Oh, it's so recent.
Right?
Wow.
Yeah. Yeah. And she was an autistic sociologist. She's still around and things like that, but she doesn't get credit a lot of times for coining that term. There are several different things to say about it. Just generally, in 1998, Harvey Bloom was published with a quote in The Atlantic, and his quote was, "Neurodiversity may be every bit as crucial for the human race as biodiversity is for life in general." So I wanted to kind of set the tone there and talk about that.
Which is a key thing because like you said, Ruby, like the average listener, if you hear about it at all, it's probably from a place of fear. Often if we talk about it, it's about minimizing risk. It's seeing neurodivergence as a negative. And what is my risk of having a child that might be different in any way, which is what we see in fertility treatment. Everybody's coming in and they want this like quote unquote perfect pregnancy. And we spend a lot of time talking about the fact that even with testing for all kinds of things we can test for, there's so many things that happen, and we don't want to treat variety as a disability, but that's kind of what that conversation has traditionally been.
Yeah, and I found an article it's called Right as Rain by UW Medicine, so the University of Washington, and it said, when we talk about diversity, one type is often left out, neurodiversity. In cultures that counts great minds think alike among its values, people whose brains work a little differently are often ignored or excluded. And I think that's a really good kind of summary of how people with neurodivergence and neurodiversity live in the world.
Absolutely. Just for maybe for kind of the more general listener, a lot of times when you talk about neurodiversity, there's several different terms that kind of come to mind with that umbrella term. So when you talk about neurodivergent, one individual that can have anything from autism, ADHD, dyslexia, dyscalculia, dysgraphia, and it's different from intellectual disability or mental illness. So those are separate categories. You can have some overlap for sure with those, but our recent screenings and things like that are coming out of Australia are suggesting that there are a lot more folks that fall on this end of the spectrum that are able to live very independent lives, that they've always been kind of part of the world, but have sort of flown under the radar because of their ability to do masking, which is basically sort of being able to pick up on a lot of the social norms, really study those extensively. But masking also leads to a high level of risk with these populations for depression, anxiety, burnout because of things like social rejection. Mm-hmm. So the more intelligent, but I love how you've defined neurodiversity. So if, let's say you have a group of folks, if you have some that are more neurotypical, so their brains work kind of more similar to what is typical of your average person in the population, but maybe they have 2 or 3 family members that have ADHD or autism or something like that, they as a group are considered neurodiverse. So neurodiverse only applies to populations. It talks about, the diversity in that population. Neurodivergent applies to the individual. And so neurodiversity itself can kind of include a lot of these different terms. There are both strengths and struggles with it. Typically what we hear about in the literature is all the struggles, but we do not hear about the strengths. So I want to kind of talk about that today. And there was an article that came out from ADHD Aware that said, once you kind of look at a lot of these different characteristics, and sometimes it can be as simple as somebody maybe not having a formal label because they didn't get tested or not being identified in that way, but they certainly have like sensory differences or things of that nature. And once you do that, it's estimated that neurodivergent folks make up at least 30% of the population. So that's a pretty large number.
Yeah.
Well, that whole concept of a spectrum makes so much sense because when you think about all the other qualities that make up people, I mean, most things are on some sort of a bell curve. We don't expect everybody to be able to run a 5-minute mile. And
That's
so
right.
It's like there's going to be people at different ends with so many physical characteristics. And so it's kind of fascinating that it's such a relatively recent phenomenon to think that maybe the way that brains work is also going to vary by individuals.
A lot of people, when they think of neurodivergence or autism or any one of those kind of neurodivergent characteristics, they think it's something that you can see. Like, oh, I can recognize if somebody is working with this neurodivergent characteristic. And in our society, we tend to want to label things and to pathologize things. So we oftentimes are pathologizing a normal variation that we are now saying is a disorder.
Absolutely.
Can we talk a little about terminology? Like, what is the difference when someone's, technically diagnosed as autistic? People used to talk about Asperger's, talking about how do these terms, what are we using now when we're trying to talk?
Yeah.
There is so much overlap. It confuses me. Like, as I am going through my own, discovery of my own neurodivergent characteristics, I have had the formal diagnosis of ADHD, but as I'm kind of going down the road, I'm also looking into what's like sensory processing concerns and also highly sensitive person. And there's lots of overlap. But yeah, let's talk about what people know as ADHD, autism, Asperger's, things like that.
Typically with autism, it can involve social communication difficulties of some kind. It can involve speech and language challenges, whether it's processing what used to be called Asperger's is now included under the autism umbrella. There's a reason for that, which I always feel like for folks with ADHD and autism, they are the experts in this field. So we always need to kind of look to them, I think, for their life experiences as opposed to the people even that have studied them, most of whom have been neurotypical. I definitely have ADHD, and there have been some interesting pieces with that. So with ADHD, a lot of times you don't have difficulties with like verbal speech, and you might be autistic and be non-speaking. So it doesn't mean that you're nonverbal. It means that you can express language through like a communication device or something like that. There are a lot of folks with perfectly excellent intellect that's amazing that have graduated from college recently. But you can also have folks that have no difficulty with speaking and things like that are autistic. So their challenges might be more that when they develop speech, maybe they don't speak on those typical milestones like children do, where you get all the baby books, but it might be that when they're 2 years old, that all of a sudden they come out and complete sentences and speak like an adult. And some of the studies on that, there's a theory called language processing, which is that a lot of people, for example, with autism and ADHD tend to process things as a whole instead of in parts. They're more likely to come out with a whole sentence when they start speaking as opposed to words. And it may take them longer before they produce that language. Speech therapists are really starting to kind of look into that, and OTs are as well. I think that can happen. Some other things that can come in with neurodiversity are learning challenges, particularly in the current educational system that we have. So it was kind of designed based on the factory model with Ford when he built the cars, and everybody sort of is learning the same way. But unfortunately, everybody does not learn the same way. It starts in about third grade when reading and math and things of that nature become less tactile in their learning styles, and they become more auditory and visual. So a lot of folks, that struggle in that way may have difficulty with processing. It's interesting having a neurodivergent child and then a friend that also has one. So, my child does great with like written language and things like that and reading those steps, but auditory is very difficult. It takes about 8 times as long to process that. Her child is actually the complete opposite and does great with auditory, but visual is very challenging. So together, if you think about how a lot of information is given in healthcare settings and also the school system, it's usually a combination of auditory and visual. So you're going to miss about half the information because you're trying so hard to sit there in a class with all the extra sensory issues, which can be part of it too. And you have all those people around you, and there can also be challenges with executive function.
And what does executive function mean?
Well, Ruby was lucky enough to get to experience that with me this morning when I could not find my Zoom link that was
me
sent.
as well, too. Before you couldn't find the Zoom meeting, I sent you an email that said, did I ask you for this? I can't remember if I asked you for this. This is going to be a fun conversation.
Related to that perfectly. But it has to do with things like planning steps to do things, a lot of times with emotion regulation. So a lot of times people that are neurodivergent can feel things much more intensely than other people in terms of their emotions, but the way that they express it may not be the same.
Which is interesting because the stereotype of autism is, the robotic, you just don't feel emotions, don't relate to other people's emotions.
So not true. Yeah, it is like one of the biggest misconceptions that they lack empathy, and it's completely incorrect. Some neurodivergent people are incredibly empathetic and actually feel things on a very intense level. I would lump myself into that category, especially in the field that I work in. I have to be very careful about making sure I don't get overwhelmed with people's emotions. And what is interesting, I'll just kind of walk you through an experience, because one of the things that is really challenging for me is actually talking, which is really funny because I co-host a podcast.
This is your idea, Ruby. You asked me.
Yes. And I talk all day long, right? But Anne can attest that most of my stuff, like there's lots of cutting, and because I trip over my words quite a lot. And throughout my elementary school years and into high school and everything, there was a lot of scripting. So I had, in order to read social cues. Like I had to basically study people. It's like a very long anthropology study happening about like how people interact and how people respond to different things. I used to write down what I was going to say when I had to call somebody. Like if I had to make an appointment, I would write that down and then read it. And then you could tell, sometimes they could tell I was reading it and they're like, and then it was a trial and error kind of thing. So when people reacted in a way that is like, okay, you're being quote unquote weird, then I'm like, okay, check that off the script. So when I'm talking to somebody, I am not only having a conversation, but I'm also thinking in my head, like, oh, what's the next appropriate thing to say? Oh, should I have said it that way? Oh, they're doing something funny with their mouth right now. Did I say something wrong?
Yeah.
Also, all the other things that are happening around me, I'm also paying attention, like, oh, what was that sound? And it's just like, it reminds me of, if you've ever seen the show Doug, the dog from Up,
Yeah.
and it's just like talking. Oh, squirrel. Like, it's a total example.
Absolutely.
Yeah, it's so funny. But anyway, let's stop talking about me. How did you get into this field?
Well, I think having a child, which was interesting going through that diagnosis process. And then, of course, like once you go through that, you realize a lot of things about yourself and your spouse. And you're like, oh, yes, we struggled in those ways too.
Well, and that's kind of the big picture thought right now, too, because I knew I came of age and like everyone being concerned about the quote unquote autism epidemic and like, why is this happening now? But the idea is these are things that were always there. And now we're kind of noticing and sort of naming more. Is that sort of what you would say, too? Or
I think so. That's kind of what studies and things show. I think it's a lot more prevalent. It's just that people typically, when they think of autism, for example, they think of those really severe examples. So they think of like Rain Man or something like that, because that's what's portrayed in movies.
yeah, I'm reading my daughter right now, House Rules, the novel by Jennifer Collins. It's such a like period piece almost now. It's like, oh, wow, like it's focusing on, this very classic media portrayal of someone with Asperger's. And I like even reading it, I was like, boy, like you wouldn't write the book this way now at all.
No.
But that's what we talked about for a very long time.
The term Asperger's has a history to it, and autistic folks, they have differing opinions on whether or not that term should be used.
But here we hop the topic all around. I'm sorry. So back to you and how you got into this field. And so you had a child and...
Yeah. And so I think part of it too is that the diagnostic process honestly is very depressing when you first get that. And so one of the goals that I had, just I guess in general for the world and also because I want to make the world a better place for people like my child. They're capable. They're not people to be avoided or something to be dreaded. And so a lot of times it's almost like if you find out when we went for, the results of the evaluation, I just remember the psychologist kind of looking at me and saying, if you just get her help, she'll be okay because she has a high IQ. So you need to put her in all these therapies. And so like one being applied behavioral analysis and then occupational therapy and speech. I remember just immediately feeling overwhelmed and thinking like, what just happened? Because the way it was presented was almost like they felt like it was as devastating as having cancer or something like that.
I remember having that conversation, being referred to occupational therapy, and like you sit in this little room and you sit on the little kid chairs and they're like explaining all the different things we've been experiencing. And it feels like you walk in a room and you're getting prepared to get really bad news.
Yes.
Well, even to start the journey, like was having the testing, was this something that you sought out or was this something that like, school or other people recommended? Like when did you start actually looking into trying to get more of a formal assessment?
I have a mom, she's a retired teacher. And so she said, there's something really different about our child. She's brilliant in so many ways, like more so than kids her age. But there's some other things that seem kind of different. And so she ran a tutoring business for a long time. And a lot of the kids were neurodivergent. And from the beginning, my mom always really believed in my daughter. And she said, you can just tell that she's like a genius. And I sort of like chalked it up to, well, she's just a grandmother.
Of course.
Grandma.
And she was my first child. And I have a spouse that did not speak until he was 2 years old. I remember when I met him, he kind of joked and said, my grandparents back a long time ago thought I was autistic or something because I didn't speak till I was 2. And then I started speaking in these sentences. He's had for sure like some struggles with dyslexia and ADHD and things like that, and did not do well in school. For my daughter, it was things like just trouble with transitions, that being really hard, and really loud noises. Typically, whenever you start going through the whole gamut with trying to figure out schools, instantly, if a private school hears that diagnosis or if a public school does, the immediate question is your child aggressive? My child's never been aggressive. She's always been very much the opposite. I mean, if someone hurts her and hits her, she's going to hit them back because that's a normal reaction. But a lot of autistic people are more likely to be a victim than they are to be aggressive. So I think that's another thing that comes up. They're more likely to be victims of trauma. So they have high rates of PTSD. So we did ABA in the beginning because I thought, like, this is what the experts are telling us to do. I don't know anything about autism.
And what is ABA?
That is applied behavior analysis.
It's very controversial.
Very much so. But then we had a speech therapist that started challenging me, and she was amazing. And she said, "Have you heard about neurodiversity?" And I said, "What?" She said, "Maybe read some like accounts from like autistic adults and how it causes trauma." And so, of course, I felt terrible because I thought I was doing the right thing.
It's basically teaching masking. It's teaching you how to fit in a world that you don't fit in, kind of thing. So it's like, is that the goal, is to try to mold our neurodiverse children into society's norms, or is that really the therapy we need to go? So that's why it's controversial. And if you ask a lot of neurodivergent people, they will have some thoughts about it.
They do, and they're right, honestly. And so we immediately pulled her out. And I never could figure out, like every time we would go to the ABA clinic, I would have major issues because I'm sure that I was seen as this difficult mom because I was a psychologist. And I just could not ignore my child while she was, melting down. And so that is the opposite of what they teach you to do. I would go up to her and hug her and hold her and just sit there with her and kind of rock her against my chest until things were better. The triggers for that were usually things like loud noises, like multiple cell phones going off and things like that. I couldn't get on board, so I was a failure at parent training, which is very different once I kind of started researching the theories and what it was based on. And the person, Connor, that came up with a lot of the theories in Lovaas were into conversion therapies for folks that are LGBTQIA, which is absolutely horrible. And so it's been similar with autistic people. He did some trauma therapy to kind of get through that, which was not ABA based. It was EMDR, which is a type of therapy that's nonverbal that you can do to process trauma, with my daughter. And we changed the way that we did things. We looked at more into like, how do we become more flexible instead of trying to force it to fit in a certain mold. And I'm really, really happy to say that like it's changed so many things. So she's doing incredibly well, trying to like do what went against the grain for her and for us. And I also started researching and finding everything I could on adult autism advocates. So I found Autistic Doctors International. I found autism inclusivity, and then I understood a lot more things, I think, about like my spouse and things like that over time. And as we were kind of going through a lot of this stuff, he said, I was pretty much a lot like this as a kid. And I was like, yeah.
Yeah.
and so like there are a lot of things that are there. So I think for the record, I guess I would just like to say that people that are neurodivergent can and often do get married, have great jobs. I work by NASA, so a good proportion of my patients are autistic. A lot of doctors are that I work with, nurses, like people that are amazing in the field that they specialize in. And so this whole idea, I think that this is some kind of negative, horrible thing, I think is interesting how that developed, because it's similar with things like anxiety, right? I mean, who doesn't have anxiety this day and age? And you have like really severe anxiety where somebody ends up in a hospital because it's really awful. And you have anxiety where people are able to go about their lives. They struggle with it for sure, but they can do things in a way that works for them.
And adapt.
And we make accommodations for things. And so there's no reason why we can't do that. The number one thing I think as a parent of a child like that always aggravates me is that, if you take them to a school or something like that, it's always like, oh, we don't have the ability to make the accommodations, even when they're like, they don't cost anything.
Yeah.
And things like that. And as they get older, they learn those skills to self-advocate. But I love that we have people like Chloe Hayden that's come out, that's been an incredibly successful autistic Australian actress. Daryl Hannah is another female example. You have Jerry Seinfeld. A lot of people say that about Steve Jobs.
Anthony Hopkins is
Yeah.
neurodivergent. Simone Biles, Greta Thunberg, Temple Grandin, of course, is like a very well-known advocate for autism and neurodivergence. But yeah, there's a lot of people that are quite successful. And historically, we're actually thinking that people like Marie Curie and Albert Einstein were probably neurodivergent, maybe Van Gogh, Nikola Tesla. I think this is a really good point to make, is it's not the boogeyman necessarily. But this kind of brings up the point that over time, kids often do start to adapt and learn some coping mechanisms. This also you start also developing the ability to mask. So a lot of adult people are now being diagnosed with some neurodivergent traits. And so there's a lot more people out there than you would think that are dealing with this. And you say you work near NASA, and we work in the tech industry up here.
We do. Yeah.
So a lot of our patients probably are neurodivergent. It's important to bring up because, as our listeners are probably aware, infertility treatment is very sensory overloading.
It is very, very difficult. And that can be true even when you have an amazing, kind staff, And so the other thing to kind of bring up, there was a meta-analysis that Loomis et al. Wrote in 2017. And that review said that the rates of autism in males and females are actually pretty close. So it's about 1.8 males for every one female. And as we all know, women get the bulk of those medical procedures when you go in.
Yes.
And it's so much fun as a fertility patient to go through that. I remember doing it. But I will say that a lot of times in women, because women in general are mostly interested in relationships and stuff, they can mask a lot more. And so while both populations are also incredibly important as we talk about that, and there's also male factor infertility, there are a lot more procedures and things that women will go through in terms of that, just because of biology. We're talking cisgender women here, but there's also a lot of overlap in the LGBTQIA community with neurodivergence, like a higher proportion than what's typical for people that are heterosexual. So because American Society of Reproductive Medicine has started to become more progressive finally in that arena, it's interesting because the responses I've gotten privately from people on the American Society of Reproductive Medicine listserv when I've advocated for this type of diversity, it's very clear that we have a long way to go in terms of neurodiversity and the lack of awareness that, that it's not something that should be avoided, because I got a private comment like that and it did surprise me. But I got many more that said, I have a kid just like that. And so, which kind of makes sense. I mean, a lot of people that are drawn to the sciences have those great skills that neurodivergence offers you, the ability to look at data and analyze things systemically and in a very systematic way, that hyper-focus ability.
Yeah.
And that wonderful ability to have it as an interest.
I'm sorry if this seems kind of basic, but as we talk about this, why is masking bad though? Because isn't masking something that we all do? Sometimes people's counter argument is that there's always this variation. There's always kids that were considered shy and had hard times talking, and that was part of your parenting, was you helped them build those skills. So how do you decide what has to have the world accommodate versus you learn to cope with the skills for the society that we have?
I think that's a great question. I would say that it's bad because in neurotypical populations, it doesn't cause increased rates of depression and anxiety and even suicidality. Average age that a person with autism would die by suicide is usually about age 58. And we're talking folks that don't have intellectual disabilities with that. And it's because of social rejection. It's because it's so much harder to read those neurotypical social cues because it's like a script that everybody else has privy to that you do not. So I think in a neurotypical person, yes, there's a level of masking that we all do, but it doesn't require that level of effort. And it's kind of like Ruby's already identified. There are 85 things that are bombarding your brain at one time while you're trying to study these social cues. And because you're trying so hard to get it right, it's something that doesn't come naturally to you like it would to somebody that's neurotypical because they just know those norms automatically. Like there's just certain things you don't say or do that are obvious to them.
And it happens over the course of your entire life. So they're finding that people that have grown up identifying as girls and women, they tend to learn to mask just because of social norms and expectations. And over time, you learn to quote unquote get better at it. But it is a long, long road. And certainly, I don't know where I was going to go with that. There you go. There's part of it.
Exhausting, right?
It is.
Yeah.
It's exhausting. And if I have a really important social thing or like I'm giving a talk or something like that, I will quite literally need to go to bed at the end of the day or for like whole day. Like I don't want anybody around me. It needs to be quiet. I just want to like sit there and read and drink some tea for not that like not everybody like it sounds like something that a lot of people probably like, but it doesn't probably feel as physically draining as it is for neurotypical people.
It helps with regulation. Absolutely.
Yeah. So dysregulation, that's actually, let's talk about dysregulation really quick. And then let's talk about like the actual evidence for like ART and autism, because I'm sure our listeners are interested on that.
Yeah.
But regulation is a really important concept for how people that have neurodivergent traits experience the world.
Maybe a good way to imagine it is, let's say that you were to walk into a room and it feels like all of these people in the room are talking about you, about something that you have no idea, what's going on. If you have ever smelled rotten cheese on an airplane that somebody has shipped and you can't get away from it, you're experiencing that.
Tuna fish sandwich or eggs.
Yeah.
Like, what the heck?
Exactly. Imagine that at the same time that that's happening, that you have these really bright flashing lights, like it feels when you have a migraine. That's kind of what it's like to be a neurodivergent person. And at the same time, somebody is saying to you, hey, can you recite your social security number backwards?
Yes.
So when we talk about emotion regulation, you have all those things bombarding you. And so internally, your body is kind of going into fight or flight. And the world can feel like a very difficult place. Do people that are neurodivergent expect the whole world to kind of bow down to them because they're different? No, but there are accommodations you can make to support that. And they're pretty simple accommodations. There are things you can offer without making somebody feel very othered, as Ruby identified, and that lowers the possibility that somebody is going to feel overloaded like that,
And I know that's kind of what we wanted to do in our snack episode. So keep listening to see. We're going to talk about like ways to make it easier for sure.
Yeah. And actually, like the Harvard Business Review published an article in 2017 that said neurodiversity is a competitive advantage. And there are ways to include neurodivergent employees because there really are advantages.
It is interesting because you've been saying that this whole time, like the fact that there are challenges, but then strong advantages too. And that's just being a person. Like we all have certain things that come easier to us and things that are more challenging. And you're right, it's kind of trying to meet somewhere in the middle where you are going to have to find some coping skills to be able to, manage in the world. But you're right, just even having the awareness so that people aren't just completely don't understand what's going on if someone's having a hard time in a situation. I mean, I think that's a key thing. Back to our hysteria episode, we used to just lock away people that were like in any way different. So,
well, and for us, that patient who is like very angry about something or is in the ultrasound room and just breaks down and cries after, it may not, of course, IVF and everything is super emotionally challenging. So that is layered on top of, but in the back of your head, it is good to know that some people might also be dealing with the fact that I have to be half naked. It's freezing in here. Somebody's going to use an ultrasound on me. So I have all this internal pressure. And then they turn down the light, but then the lights are back on. And it's a lot of sensory input happening. Oh, and then the blood draw and all of that kind of stuff. So melting down, one thing that really drove me crazy when we were going through our journey with our son was he got the diagnosis of tantrums in his medical diagnosis with a pediatrician. And I was like,
is tantrums is that an actual diagnosis code you could use for
I don't
it?
know, but it is in his chart. And I was so upset because I was like, no. This is not a tantrum, okay? A meltdown is a completely different thing, and adults can have meltdowns. They don't look like the kicking and the screaming on the floor. Well, sometimes they do probably, but
Yeah.
sometimes I want to. But
agree.
oftentimes for me, it is like very short temper and snapping at people. Poor Dion, like if I am trying to focus on something like editing a podcast or something like that, and he's trying to talk to me, oh, he gets it immediately, because my brain is taken somewhere else, and that's really hard to deal with. So
Yes, absolutely.
well, let's talk about the evidence for whether people that go through ART IVF more commonly have children that end up being neurodivergent in some way.
There's a lot of mixed information about that in terms of the reviews. Kind of the prevailing piece of it, I think, is that basically the ART does not really cause an increased risk of autism. A lot of times people will say, well, that's more of a risk if you're an older parent, like, if the male partner's over 41.
Especially on the males, yeah.
And we will be talking a bit about what does the evidence say later on in the episode when you are trying to study ART and how it might relate to autism and other neurodivergences, because we know there are a lot of listeners that are going to be interested in that information.
The other thing we know, too, is that neurodivergent folks tend to have children later and things like that. They tend to be in careers that are kind of more typical, I think, of neurodivergent traits and things like that when they do have kids. If you go and you're a physician or something like that, it takes a lot of years of school, a nurse practitioner. So it's hard to parse out whether that risk is there simply because of age, because you can't really compare children that they would have had younger since they didn't have them then. So you have a lot of confounds there.
And what's the actual increase in relative risk? I think that's one of the things we wanted to try and talk about today when you say something's more likely that people go down this whole pathway. Like, what are the numbers we're talking about?
It's 2.3 times more likely. So that's kind of what the odds ratio is as far as like prevalence rates with children.
Yeah, I think I saw something that said children that were conceived using ART were about 0.8% of those born as singletons, and then 1.2 born in twin or multiple gestations had autism spectrum disorder. So if you're thinking about like absolute risk, it's still quite low.
Because, when you see a news story that says twice the risk, that automatically just makes people be,
makes it scary. Yeah.
Yeah, when they looked at that, it says that its prevalence in the U.S. with IVF is about 18.5 for 1,000 births, 1 in 54 kids, and then 25 for 1,000 births for another study with a pretty big data set from ages 3 to 17. And that was a 2001 review, Saxena.
Going back to what you said in the beginning, we have a lot of patients that are like, oh, we know that we can test for autism now. How do I do genetic testing?
I just got that question the other day.
So they haven't identified all of the genes, and they're still continuing to do a lot of studies on that. There's not one specific gene that causes it, but we do know that it's not caused by things like vaccines and things like that. That's been disproven for a long time with the Andrew Wakefield paper that was published in the Lancet. It could be by some kind of environmental exposure, but they think that's less likely than genetic factors. So it's something about the combination of a lot of times like de novo, mutations that can happen early in that first trimester of pregnancy, and we don't have the ability to really test embryos for autism at this point.
Well, and also like all things genetic, they were talking about contributing from both sides. And it seems like it would make sense that people who are neurodivergent might connect better with someone else who also is.
Yeah. And another thing to consider is because we talked about like absolute risk and the risk being relatively low overall, but also that spectrum, again, bringing that spectrum in. So not all children that are from ART that are maybe diagnosed with ASD or autism spectrum disorder are going to have that stereotypical severe case. And this is not to say that having a child with autism or other neurodivergence is not challenging or life-altering. I don't want to imply that it's easy breezy and that we shouldn't talk about it. And I definitely don't want to forget those who have significant intellectual, communication, or other differences. It's a complex conversation with lots of layers, and we still have a lot to learn about genetics, about other contributing factors.
There are some epigenetic factors I think might play a role in this. So advanced paternal age could be one, complications with pregnancy or delivery, multiples, like you mentioned. But there's also studies that will go back and look at those and rule out some confounds and show that that's not part of it. So research is mixed. We really don't know.
Yeah. And even if you do fall in those statistics, which we really don't know, but even if you do fall in those statistics, like you don't know if your child is going to have intellectual disability or if you're going to have somebody that thrives in one area, a la Greta Thunberg. Oftentimes there are some really incredibly cool traits that come along with it that you wouldn't necessarily get in a neurotypical child. So we have things that we can offer for sure.
Since we're talking about that, and we do have a lot of folks that have exhausted fertility with their own gametes, and maybe they use third-party reproduction as kind of a newer option for how to have children since probably about, the mid-'80s or so when they started working with egg donors and the like. So currently, American Society of Reproductive Medicine kind of encourages against working with a donor that has ADHD or something like that. I did want to share that I screen a lot for a major clinic. I work with a lot of different ones and agencies and things. So I was excited to be able to change that conversation because I got an email from third-party nursing that said, oh, this donor has ADHD and they've donated before and you cleared them. Why is that? And I said, well, there's nothing in the guidelines explicit that, denies that. It just says you kind of disclose it. And the intended parents were fully aware. It was a non-directed donor, so not someone that they knew. But both of them were physicians and they both had ADHD. And so they said, we want a donor with ADHD.
I love that.
So one of the conversations I had was like, isn't this a bit paternalistic for a clinic to turn this person down? She's been a great donor 3 times. She has 2 master's degrees. Because the comment I got back was, well, this is a less than desirable thing. And I said, well, I think we need to change the conversation that we're having about diversity. So we can accept all these other forms, but we can't accept this really gifted person.
We still don't even do good with the other forms of diversity. So, and we haven't even started the conversation on this one, really. So
it's hard enough if you're from a marginalized population to get, either nutrition.
And you can be double and triple marginalized too. You can be a person of color, you can be LGBTQIA and neurodivergent. So
absolutely, all of those things. Mm-hmm. And that could still be an amazing donor.
That's what I was going to say. It's like, that does sound like a great egg donor.
Yeah, and that's just such a good example, though. I just love that example of the donor because it does come up a lot in donor gametes too. So that's a really important thing to point out. Let's see, what else? Anne, is there any...
I was going to say, we could obviously talk about this for a long time. I think that's great in terms of the key stuff we wanted to mention, but any other big picture concepts that you wanted to make sure we touched on?
Yes, I did want to say for people that are neurodivergent, a lot of times they don't know they're neurodivergent because they've never been evaluated or not. Yeah. For women, particularly cisgender women, they're used to the masking. So one kind of fun thing to share, I guess, about me, I had stage 4 endometriosis. And so for probably 20 years, I had this going, and I just thought it was normal for people to feel like they were going to pass out and feel in a lot of pain every month. And so I just kind of go about my business. And when my doctor finally discovered that, like, we need to go in and do surgery because there's this, like, cyst that won't go away with birth control pills and stuff. They found it all over my body, everywhere. I had the biggest cyst they'd ever removed that was, like, the size of a Coke can.
Yay. Congratulations.
It's not what you want to win for with that. Right. And one of the things she said to me was, like, why didn't you tell me that you were in this much pain? And I said, well, I didn't know. I thought everybody was like that.
You're N of one.
And a lot of times I think if you're neurodivergent, you can either have a very low pain tolerance or a very high pain tolerance. I tend to be one that has a high pain tolerance. So I'd broken my arm before and not gone to the doctor for 2 or 3 days because I just thought, okay, I just fell. It doesn't feel great. And then you get in there and it's broken in 3 places.
Yeah.
So, something to keep in mind.
It shows the spectrum too, because, you know, a lot of people think everything is amped up, like I mentioned, but not necessarily. My son's the same way. When he was younger, he would run outside. I'm like, you're not cold? Like, you should be cold. Like, he just didn't sense that. So this is a good point to end on, actually, that show, you know, we talked about general terms, but like everybody else, neurodivergent people are diverse, you know, so there are no two brains that are alike. So everybody's preferences and what they experience and things that are hard for them or where they excel are going to be different. And with that, I think we're going to stop the conversation here, but make sure that you tune in a few days on Saturday to hear what maybe are some things that can make an IVF clinic or fertility clinic a little bit more friendly for those neurodivergent people.
Thanks so much for your time.
Thank you.
Thanks for joining us for this week's episode of the Whole Pineapple Podcast. We hope it was helpful.
If you know someone who could benefit from hearing the podcast, we hope you'll share it with them.
And don't forget to subscribe, rate, and review the Whole Pineapple on your favorite podcast app. Every rating and review makes us easier to find.
This podcast is sponsored by Seattle Reproductive Medicine and is produced by Audiotocracy Podcast Production. We'll see you next time. Have a delicious week.